just love for you to help promote the education, because what you just said is what I hear multiple times a day. I wish I would have known.
Yeah.
So
Thank you
we're
for
going to make
coming.
that out there so everybody does know.
Yeah. I'd love more people to know.
Yeah, I'm on board with that too. I really love what you're doing, Dr. Siegel, and I'm glad that we can have you on today and have the chance to see your presentation, which I know. Oh, hi, Karen in the chat. Sorry, my laptop is not playing ball. Hello, everyone. I work in canine nutrition with Dr. Connor Brady at Dogs First. Very nice to meet you. Everyone, welcome to our monthly peer discussion. This month's lovely facilitator, Dr. Marlene Siegel here. And we're having people trickle in as we continue on. So please don't mind that. Welcome, Kristen. So many great faces here today, and I'm excited to see everyone kind of come together and learn a little bit more about holistic pet health. Before we get started with Dr. Siegel's presentation, which I might mention is about an hour, so we might go a little over time. Promise it'll be worth it. But before we get started on that, I just want to give a quick introduction to Dr. Siegel. Dr. Marlene Siegel is a pioneering veterinarian who's been at the forefront of integrative and holistic medicine for pets for over 30 years. As the owner of Pasco Veterinary Medical Center in Florida, she offers a wide array of alternative therapies and detoxification services, so her practice is one of the most comprehensive in the country. She's passionate about educating pet owners and veterinary professionals on integrative approaches to animal health, and has developed her own raw pet food company, Evo Love Raw. Check out evoloveraw.com for that. She has a line of supplements, and she's has a strong focus on adrenal health, stress management, and cellular detoxification. Dr. Siegel is dedicated to promoting balanced lifestyles for optimal well-being in animals and their human companions. She's an avid speaker, innovator, and educator, constantly pushing the boundaries of integrative veterinary medicine. And
hey,
we're
Deanna,
here
you might
today.
want to listen to this. Do you have a JBL clip somewhere?
Hi, Dan. I'm going to mute Dan. So excited for this one. It sounds like everyone is too.
Like everybody is too. That's wonderful.
Yeah. So, I mean, with that, let's not hesitate. Dr. Marlene Siegel, thank you so much for joining us. Welcome.
Thank you, Daniel. And thank you to everybody who's taken the time out of their day to enjoy this. I'm really glad it's going to be recorded, so those who signed up and couldn't make it will still have that opportunity to get the information. So we're talking about detoxification in particular, but the real focus behind detoxification is helping to take us from a state of surviving to a state of thriving. And what I mean by that is our bodies and our pets' bodies are adaptive. They are designed that when circumstances are not ideal, maybe we don't have food resources or we have exposure to too many toxins, our body goes into a survival mode, which allows us to stay alive. However, that is not what promotes health and longevity. It's moving to thriving that allows us to really live that abundant lifestyle. And that's our end goal. How do we get from surviving to thriving? I don't know how to make this thing go away, but I have on my screen is the meeting being recorded. It says okay or leave, but I can't seem to make that go away. Daniel, can you make that go away? Because it's covering some of my slide.
I can't see it on my end, but I think if you just press OK, it should go away.
When I press OK, let me see. You know what? I'm going to stop sharing for just a second.
Sure.
Then I can use my cursor, and there it goes away. And now I am going to go back to play. All right.
Wonderful. That work?
All better. All right.
Okay.
So talk about the allopathic training that all human doctors, all veterinarians go through. And in allopathic training, we are awesome at naming it and blaming it. And that's really what the focus of our education is understanding what the disease is. So then we can use symptom suppression. Holistic medicine really is not a woo-woo term. It means the whole. And it's about taking body, mind, and spirit and being able to nurture that. I take it one step further and I do bioregulatory medicine, which is where we really understand the biological systems and how they're affecting our overall health. Now, as sexy as everything as I'm going to be teaching you, we can't, as practitioners, forget that we have to have a good foundation. That means we need a thorough history, a thorough physical exam. I call it from the tutor to the snooter, and a thorough workup. We are seeing such a dramatic rise in complex diseases in animals. Currently, the statistics for cancer in dogs, it's said is 1 out of 1.65. I think it's actually a little higher, but 1 out of 1.65 is almost 100%. And cats, they say, is 1 out of 3, guaranteed. That is highly underreported. And when we include obesity, autoimmune disease, arthritis, allergies, and gastrointestinal disease, I think every veterinarian would agree we're seeing almost 100% of our animals with some form of dis-ease. What's even more alarming is that the life expectancy has gone down by 7 years compared to 20 years ago. This was a 6-year-old male Rottie that came into me this week. And if you look where the arrows are pointing, that is an osteosarcoma. The top of that humerus is gone. Now, I don't know how long this dog was limping. The people brought him in because they said he suddenly wouldn't use the leg. That it was horrific amount of disease going on that had to have been going on for quite some time. And this is a 6-year-old dog. This dog presented for rear leg lameness. And when we did the x-rays, there were 3 huge tumors in this dog's abdomen. This owner chose not to do anything as far as treatment, and this dog was euthanized within 2 weeks. The next area that we really have to take a hard look at is antibiotic resistance. In my practice years, I've been practicing, next year makes my 40th year in practice, and we've always had antibiotics available to us. However, now the rising rate of antibiotic resistance is becoming a real life-threatening problem. We're not going to have antibiotics in under 20 years, guys. So it's super important that we find safer and more effective alternatives. Sadly, we see people in the community, their animal gets sick and they go, oh, can you just give me an antibiotic? They don't even understand what antibiotics treat. They think it's the answer to all, and it is not. The next picture I'm going to show you is a little gross. So if you are not a practitioner, it's a little disgusting. However, it's important to see because this is a dog that had an allergic reaction to an antibiotic. She was 3 months old. She was attacked by another dog in the household. They went to the vet appropriately, was put on an antibiotic. Then the dog got better, falls off the bed a few weeks later, has another episode. Now the veterinarian puts the dog on an antibiotic again. I don't know if that one was warranted, but it caused all this tissue necrosis around the eyes. When the owner came to me, she said, no one will treat this dog. They're all telling me to put the puppy to sleep. And I looked at her and I thought, this is really going to be hard, but I made a commitment many, many years ago when I was told that my horse could not be saved and I should put her down. And it was a turning point in my life and my career where I said, I am not willing to use those words to anybody. And I fixed my horse, by the way. And so I made a promise I would never utter those words. There's nothing more that can be done to somebody. So I started treating this puppy. We got her all the way to the picture on the right. Now she had no eyelids, and which meant that she had no way of blinking and spreading tears across her eyes. And I called in a couple of human plastic surgeons, and they were going to reform eyelids for her. The night before she was supposed to have her surgery, she started developing an upper respiratory tract infection. And they insisted that I put her on an antibiotic in order to not have a problem and complications. And against my better judgment, I did do that. And she had a severe reaction and passed away in 4 days. So my point in this story is that antibiotics are not innocuous. We have to be careful with their usage, and we have to know that there are toxic reactions that can occur. The next myth I want to dispel for everybody is how old should our pets live to? Because we have pet owners that are coming in thinking that their animals are 10 and 12 and 13 years old and that they're old. Well, we do age, yes, but we don't have to grow old and decrepit, and that's a fallacy. I am turning 70 in another year, and I refuse to age ungracefully. So I walk my talk. This is Cream Puff. She's in the World Guinness Book of Record in 2010, clocked in at 38 years and 3 days. The same owner is a plumber in Texas, had another cat that lived to be 34. I think it's interesting, both of his cats were obese, but they still had great longevity. This is Maggie, 30 years young in Australia. She lived on a dairy farm. She'd practiced intermittent fasting on her own. She had high intensity exercise every day as she was herding the cattle around. She did get fed a kibble diet, but most of her food actually came from eating placentas and raw milk. This is Bobby. I think Bobby transitioned at 32. So these are not enigmas. These are animals that are making the news, but we should be able to see our animals live into their 30s. And this is Echo. I know his age because he was my cat. He was 22 years old in this picture. And if you look at his eyes, they are bright, they are clear. His coat is full. There's no muscle wasting. This was a vibrant cat until 4 days before he transitioned in the age of 23. Now, the next thing I want to talk about, specifically aiming towards pet parents and veterinarians, is the importance of doing a thorough history, thorough physical, and a thorough workup. So this dog, Rufian, was taken to an emergency clinic because she started acutely vomiting and not wanting to eat. ADR is a term that we call ain't doing right. So very classic term here. And so she goes to an emergency clinic. They assumed she had an infected uterus. Good assumption. However, she did not have an infected uterus. So all they did was a quick ultrasound. They didn't find the uterus enlarged, and they sent her home on an antiemetic. They didn't do anything else. She comes to me 4 days later, and she has an exceedingly high white blood cell count. My first differential, like theirs, was maybe it's an infected uterus because this is a super high white count in a non-spayed female dog. But I did a thorough workup, and it wasn't a pyometria. This dog actually passed a kidney stone into the ureter, which blocked the ureter, and that kidney was dying. So I referred them to the University of Florida to see if they could save the kidney. They could not. They were going to charge the owner over $10,000 to remove the kidney. They couldn't afford that, so they came back to me. And I will tell you that surgery that I did was worth every bit of $10,000. It was the hardest surgery I've ever done. That kidney, when I opened the abdomen, was absolutely spewing pus. There were adhesions and a mess inside. We successfully removed the kidney. There you see the stone in the ureter. And I knew she was going to have peritonitis because there was so much pus in her abdomen. I did copious amounts of lavaging her abdomen with ozone saline, of course, laser, intravenous ozone, everything. And she had a very mild case of pancreatitis, went home 4 days post-op, and lived a wonderful life. This is the 6 steps to health and healing that I will use on every case that I show you. So step number 1, we stop doing the things that are causing the disease. And guys, there's no shortcut to that. The things that we do that are polluting the body include feeding a non-species appropriate diet, using toxic water, tap water in particular, doing things that create toxic air in the home, using air fresheners that have a lot of chemicals and pollutants in them. The things that touch the skin, having a lot of xenoestrogens in the laundry products, a lot of EMF, electromagnetic frequency pollution, is huge in this arena. And then, of course, our thoughts are very important as well. Number 2, we have to supply the essential nutrients. Now, these are the nutrients that the body cannot make in sufficient quantity on its own. We have to eat them. And I think it's very interesting that this magnificent machine of a body that we have, our Earth suit, still requires certain essential things that have to come from nature. And if they're not in our diet, our bodies go into survival mode, but they can't go into thriving because they're deficient. So that's really important to make up. Number 3, we have to heal the leaky gut. I trust that most people today understand what leaky gut is. That's where those tight junctions that act like a piece of cheesecloth, filtering what's going down the GI tract, only allowing the right nutrients into the body, and everything else has to go out the poop chute. When that gets damaged, it's like taking your cheesecloth and punching holes. And then when you go to strain your soup, pieces of things come through that cheesecloth that were not supposed to come through. They then go to the liver, where the liver says, oh, foreign material, and its job is to mount an inflammatory response to kill the invader. Well, that's a wonderful process, and that has helped us to survive for all these millennia. However, when that process doesn't turn off, and it happens with every bite of every meal, every day of your life, then you start having chronic disease. Number 4 is detoxification. Now we have 6 organs of elimination: the kidney, the colon, the lungs, the liver, the skin. And I'm going to include fascia with the lymphatics, even though they are technically separate systems. The lymph runs through the fascia. These are critical, built into our body mechanisms for detoxification. The problem is, in today's current world, we have so much toxicity that we are overwhelming the body's ability to actually do its job. And now we're starting to see dysfunction. Number 5 are the mitochondria, the little energy packets that help us to make energy. But the mitochondria also are the communication system that works through the fascia to the microbiome. And they communicate back and forth, telling what needs to turn on and turn off, depending on the signals that they're receiving from our input, how we're perceiving life on the outside. Number 6, super important, it's clearing trapped emotions. There are always, dis-ease has trapped emotions always associated with it. And the ants in our brain, those are the automatic negative thoughts. And the reason those are so important is because when we are in a state of having negative thoughts, we are in a high sympathetic state, and we're creating neurotransmitters that are communicating to our cells saying there is danger out in the real world, and we have to be able to respond to that. So in my world, there is no disease. There is dis-ease. That means the body is not in balance. And as I have already alluded to, the first thing that causes dis-ease is having a deficiency of essential nutrients. The second thing is an excess of toxicity. And in most of our situations, there's a combination that, along with mitochondrial dysfunction and trapped emotions, is what is the underpinning of all dis-ease. I want to show you a case. This is a 4-month-old dog named Sophie, a little toy Aussie, who came in to their vet because she was limping. Owners thought at first she just injured herself playing with her sibling, but the lameness didn't go away. The vet takes x-rays, say the dog has need for a hip replacement, puts him on a non-steroidal anti-inflammatory, and sends the dog home. The dog doesn't get better on the medication. So the owners decide to bring her to me for a second opinion. When I worked this dog up, she had 5 significant levels of heavy metals. She had several nutrient deficiencies that led to metabolic dysfunction. This is a 4-month-old dog, guys. This is young. If a standard allopathic approach to this dog was to give her a pain medication and never address these underlying causes, we can see why very rapidly this dog would have had relapses. She was also vitamin D insufficient, magnesium deficient, and at 4 months of age, hyaluronic acid is a test for osteoarthritis. So this dog is already positive for osteoarthritis. Ziva, 13-month-old Australian Shepherd, presents with a rash in her skin. And most veterinarians would have done some form of a steroid, topical or oral, and some antibiotic. But I worked the dog up, and I found that she was deficient in almost every nutrient we tested for. She was on a kibble diet. And then we tested for inflammation. She had a mild amount of inflammation, very positive in osteoarthritis, also deficient in vitamin D. The reason why vitamin D and magnesium are so critically important is that they're required to run the innate immune system. So if you're deficient in one or both of those, your innate immune system doesn't work. So again, imagine if this dog, if the root cause was not addressed and we just did symptom suppression, she would have continued to have relapses, and each one gets worse and worse. With both of these cases, we address the root cause, we fix the deficiencies, we help to detoxify the toxicities, and these dogs return to normal within a very short period of time. This is the toxic metal test on that dog, and you can see she's really off the charts for several things. Now we're going to talk about species appropriate diet. I would not feed a hummingbird the same way that a lion eats. So each species, nature designed them to be able to function with their species appropriate diet. I am not making this up. All we have to do is watch National Geographics, and it's very clear how these animals were designed. Nature really doesn't waste energy doing things that are inappropriate. So carnivores were designed to eat an animal in the state that they killed it in. I don't care if you want to be vegan. I don't care if you have your different opinions about food and diet. We have been sold as a society on fast, cheap, and convenient. And kibble and canned processed foods are nowhere near a sustainable diet for these animals, which is one of the reasons why we're seeing these ridiculous rates of dis-ease. Dogs are scavenger carnivores. Because they have lived near mankind for a long time, they've adapted to eating some of our garbage waste, but it is not the diet that will make them thrive. It is just allowing them to survive if they can't find enough food. Cats are obligate carnivores. They actually have no dietary requirement for carbohydrates. This is actually listed in the American Association of Cat Medicine. They tell you that. No dietary requirement for carbohydrates. Their biologically species appropriate diet is the composition of a mouse. Doesn't mean you have to go put a mouse in your Vitamix, but this is the composition that they would thrive on. In addition to feeding their species appropriate diet, which in my opinion is a raw food diet that is balanced with meat, fat, bone, and organ meat, we need to supplement the essential vitamins, minerals, fatty acids, and aminos, along with pre and probiotics. And water is extremely important, having a structured filtered water so that these animals aren't taking in more contamination. This is Sammy, typical 12-year-old, comes in drinking a lot, peeing a lot, blood sugar is 447. She's a diabetic. He is a diabetic at this age. He weighed 27 pounds. He was grossly overweight. So yes, I did put him on insulin to get him under control, but at the same time, I got him on a species appropriate diet, the right supplementation. And 9 months later, Sammy lost a dog. He went from 27 pounds down to 15 pounds and was no longer a diabetic. So these animals, if we don't totally damage their pancreas, can actually reverse their disease. I have to talk a little bit about water because it's such an essential element within our bodies and our pets' bodies. When I went through school, albeit very many years ago, we were told there were 3 phases of water. There was the vapor, the liquid, and the solid. Through the work of several scientists, including Dr. Gerald Pollack, who is still a professor at the University of Washington, we now know that there is a gel phase between the liquid and the solid. And the importance of that answers why clouds stick together, why when we cut our arm, our skin doesn't just ooze out water, because we know we're made of 70% water. What kind of water that is? It's structured water. So this is a graphic that shows that our organelles and our cells have this film around them that when charged, it's a negatively charged phase called the 4th phase of water. It has very many names. It's called 4th phase water. Easy water is what Dr. Pollack calls it because it's the exclusion zone. And when it is expanded, it pushes all the solutes out into the bulk water, creating this very strong structure of negative and positive charge. But when it collapses, the cells start to fall on each other and get sticky. These are some of the other names that you'll hear structured water called, but this is what makes up everything in our body. It makes up our blood, our fascia, bone marrow. Everywhere in our body, we have structured water. When we become dehydrated, it only takes 2% dehydration to even see cognitive dysfunction, and this is in humans. And when you're 10% dehydrated, we all know that you are really headed for some bad disease. How water gets into our cells is through an aquaporin. It's like a membrane that surrounds our cell. And it has these little holes, the aquaporins, that are a certain size, and they're designed to allow structured water into the cell. But when we are drinking water or exposed to water that is not structured, it can't get in the cell. Only the small molecules can, and that is what leads to cellular dehydration. A lot of people, when we're taking our history, I told you it's really important to take thorough history, they're feeding their pets either tap water, or they think that the water coming from the refrigerator is somehow filtered. Well, that's only taking out chlorine and iron, so it smells better, but it's not truly filtered water. Bottled water is not better. The plastics in these bottled waters contribute over 24,000 additional toxins to the 85,000 toxins that are in tap water. And depending on where you live in the country, that number may be even higher. So we're seeing glyphosate, we're seeing heavy metals, amazing amount of toxins that are in our tap water. So we have to take a very serious look at what is the water that we're giving to these animals. I have another piece to my water story that is very important for me, and that's the usage of molecular hydrogen. Now, we know that our bodies make free radicals. It's just a byproduct of life. And the amount of free radicals that are produced at any given time used to be matched by our diet. So our ancestors, they ate enough antioxidants to meet the oxidative stress that they were under at any given time. But in our modern lifestyle, there is no way that we could eat enough antioxidant foods to meet the amount of oxidative stress that we have. This is where molecular hydrogen comes in. There are companies that make machines that add molecular hydrogen into the water. It is still a gas and it's volatile, so it's not going to stay there for days. But when you make a fresh glass that has high levels of molecular hydrogen, that hydrogen actually donates its electron to the free radical. So you have an H positive and then an OH minus, and each time you do that, you're making a water molecule and you're neutralizing those free radicals. So it's super important. Some machines use electrolysis. The machine that I like uses a magnesium reaction, which is great because we're all magnesium deficient as well. And it requires no electricity. So this allows us to start meeting that oxidative stress level that we have to be able to do to help reduce those free radicals. Now, I'm going to talk a little bit about red blood cells in their normal state. The job of a red blood cell is to use its surface area to pick up oxygen from the lungs, deliver that to the tissue. Then it picks up waste material from the cell and delivers that out the body. And again, it uses its surface area to do that. So this is a picture of a live blood analysis. Literally put a drop of blood on the slide, take a picture of it, no stain. And we can see that all those cells are nicely separated. Well, when we went to vet school, we were taught that rouleau is normal in horses and cats. Big lie, caught you with your pants down. That is not normal in any species. And I have study after study, hundreds of studies showing that I can make rouleau go away. And the reason this is so critically important is imagine you have all these cells sticking together like a slinky. Well, the fourth phase of water has collapsed, whether it's due to toxins, due to stress, due to EMF, whatever. These cells have now started to cover each other. Imagine taking a group of tennis balls. If you take one tennis ball, put it underwater, the whole surface area is connected to the water. But if I start packing a bunch of tennis balls into that bucket, now only a tiny amount of the surface area of that ball is touching the water and the rest is getting covered by another tennis ball. And that's what's happening in rouleau. So we cannot accomplish good cellular function. We're not getting oxygen to the tissues. And when you don't have enough oxygen in your tissues, you create a terrain that is conducive to toxicity and disease. And then, of course, you can't get rid of waste products either. So not normal in any species. This is on the left is a live blood study of a cat who came to us very sick. That doesn't even look like red blood cells. Those are like little chips of crystalline something or other, but I don't know how this poor animal was alive. We put this cat in our pulse electromagnetic frequency machine, and after 2 consecutive treatments, we still see a lot of rouleau, but at least the cells look round. They look like a red blood cell. We did a total of 4 consecutive treatments, and that's what the blood turned out to look like. And coinciding with the improvement in the red blood cells was also how well this cat started to feel. He was eating better. His entire mentation changed. He felt better. He was more active. He had more energy. It was really amazing to watch. This is a horse. I had gone down to the racetrack and I did a series of horses. And in every case, these horses' blood literally looked like that on the left. Now, this is a video, and these cells were just almost not moving. They were stuck together in clumps. I put a frequency device on these animals. They went out, did breathing on the track. They came back in, and 165 minutes later, I retested them, and this was their blood on the right. Again, we were able to use frequency to separate and expand that fourth phase of water. And how interesting, this horse was actually a little anemic. And you can see the different sizes of red blood cells where when they're stuck together and they look like a big clump, you can't even appreciate what's going on in that horse, but definitely was anemic. No wonder these animals are having a hard time. Next area that we have to cover before we get into detoxification is the importance of the autonomic nervous system. Now, we know there are two branches to the autonomic nervous system. We have the sympathetic branch and we have the parasympathetic branch, and they are on a teeter-totter from each other. If you're a super balanced, they may be equal on the teeter-totter, but in most instances, when you have a danger or something happens in your life that pushes you into a high sympathetic tone, it's going to push your the parasympathetic side off while the sympathetic side turns on. Perfect system when danger's around. When that saber-toothed tiger jumped out of the woods at our ancestors, it's a good thing they could mobilize their energy. Cortisol levels went up. The blood was pumping to their legs. They could run, they could fight. Amazing process. But once the danger is over, we're supposed to go back into a parasympathetic state, which is the only state where we can rest, repair, digest, detoxify, and reproduce. And it makes sense. If you're running for your life, you don't remember if you have to pee, you're not hungry anymore, and you really don't care who you're going to have sex with because all you care about is surviving. Even though we don't have the saber-toothed tiger jumping out at us every day, we do live the sad life. I call it the standard American day. And if you're in Europe or another country, don't laugh at us because I've been there and you guys have the same thing. I just didn't have an acronym for it. So what does it look like? The alarm clock goes off at 7 o'clock in the morning and we're exhausted. We're still sleep deprived. You get up and you eat some kind of a sugary carbohydrate breakfast. You get the kids off to school, which is always a stressful event in and of itself. Then you're stuck in traffic if you still go to work. And then you're exhausted by lunchtime. After school activities, whether they're yours or the kids, you don't have time to make dinner. So you eat that fast food junk that is cooked in seed oils and full of fats, horrible for you. You open the mail, you have credit card debt, you have a fight with your spouse, you just want to knock them out. And then you finally get the kids off to bed after doing homework with them, and you still have project deadlines. So you're up late at night. Before you know it, it's 2:30 in the morning, and you are going to bed too late, and you're not getting enough sleep, and then your day gets to start all over again. How about in the chat, somebody raises their hand and say you can relate to any part of that day. And if you don't raise your hand, I want to know what you're doing differently because all of us are living a stressful lifestyle. The ants in the brain, we talked about that before. These are the automatic negative thoughts that we have. And we all have them, guys. I call it stinking thinking. And it's not that we have it. The problem is we get stuck in the stinking thinking. But if we use it to recognize what are those negative thoughts that are coming up, and do I want to keep those negative thoughts or can I shift them into something more positive? I could do a whole lecture on just that. Why this is so important is because we know that the autonomic nervous system has a vagus nerve. And we've all been taught that when the vagus nerve is stimulated, it helps you to go into parasympathetic tone. And that is true. That's where you go rest, digest, detoxify, and all the other stuff. However, there are two branches to the vagus nerve that we now know. The dorsal branch is what drives the high parasympathetic tone. It allows your mitochondria to be happy. You're making lots of ATP. You're fueling all your metabolic functions. But there's a dark side to the vagus nerve, and that is the ventral root. And when the ventral root is stimulated, it creates something called the cell danger response mode. So there are a certain group of people, sadly, a large group of people that get stuck in this high sympathetic tone. It's almost like they can't get away from the danger. So the body has this mechanism to go into cell danger response mode. And the mitochondria, thinking that their planet is about to die, they go into this bunker, and it's like a play dead freeze response. Sort of like a possum, when the possum thinks he's going to die, kind of rolls over and plays dead, but he's not really dead. And what happens is when you go into cell danger response mode, not only do you shut down ATP production, but you cannot go into parasympathetic tone to do the rest, repair, and digest. So this population of humans that get stuck in cell danger response mode, no matter what therapy they do, they cannot get better. This is how we start to fix it. So now the next portion of the presentation is going into all of our methods of detoxification. The very first thing you should know by now is that we have to get parasympathetic. This machine produces pulse electromagnetic frequencies. Not all PMF devices are the same. In fact, this is the only machine in my awareness, and I've done this for many, many years, that works in the picotesla ranges. And that means it's in the very low frequency. In fact, what this machine does is it tickles us back to the normal resonance that our cells are supposed to be functioning at. Devices that have high PEMF are considered disruptive frequencies. It's almost like they turn the breaker off, but it's only temporary. When the breaker comes back on, the problem isn't fixed. So you have a temporary feeling of better, but it's not lasting. Where in this technology, it is actually entraining you back to normal frequency. So this is the device. We have a couple of our technicians in holding their patients. And on the right-hand side is a very dear friend of mine, a very famous veterinarian, Dr. PJ Broadfoot. We are at a North American conference, lots of activity going on in the floor of the event center, tremendous amount of noise. And because the frequencies were so strong, it allowed her to fall deeply asleep despite all of the commotion going on around her. Now, this is a different technology I'm going to show you. This is Lucas. He came in as a 5-month-old. ADR, remember, ain't doing right. And I'd taken x-rays. I already knew he had some spinal misalignment, and I'm trying to do a chiropractic adjustment. And Lucas is having nothing to do with this. He's going to fight to the end. His mom is not happy about having to struggle with him, and I'm just not going to get it done. So I started using a technology which uses sound frequencies. It's been playing for 3 minutes. I didn't want to play the whole thing for you, but notice Lucas has now laid down. His mom is not holding him. She is not forcing him to be there. He lay down on his own. Watch his eyes. Do you see how heavy his eyelids are getting? He does a big yawn. This is parasympathetic. He cannot stop the feeling. He's trying to be reactive. He's a hyper little ADD dog. And then he puts his head down. Now, here's the test. Can I adjust him in that parasympathetic state? And the answer is yes. She's petting him. We're not having to hold him, and he is not struggling. That, my friends, is parasympathetic, not using drugs, and no manhandling. Yeah, mommy just lifted her arms. So this was his x-ray beforehand. So I could see his back look like a teepee. It was very arched. You didn't notice it so much when you saw him from the outside because his back kind of looked like it was level. But on the x-ray, you can see his back is really arched up. He was having a lot of muscle spasms. And then after adjusting him and getting him to relax, his back straightened out. And his ADR went away and he was fine. This is Chirp. Chirp was 23 years old in this picture. He had split his beak when he was a baby. And they went to a couple of different veterinarians, even a referral center, and everybody told her to put the bird to sleep because it wouldn't be able to live. Well, she said, no, she's going to try. So she brings him to me, and I did try to repair the lower beak, and it would not grow together. As a consequence, he didn't have any ability to rub against the upper beak, and so the upper beak would continue to grow. So every 4 months for 23 years, this bird came to me, and we trimmed his beak. But he was also burly. I mean, just look at his eye. He's gonna be a stink eye in that picture. And you can hear he's mad. Listen to his chirping. Mad.
Takes about a minute.
But we're playing the frequency music. Now, his daddy's going to give up, and because he bites him several times, and he just puts him back into the cage. Within another minute
ring
of him putting the
functions.
bird in the cage,
Come on.
I'm able to take the
Sure.
bird out, trim his beak,
Go
one
back.
hand, okay. Turp went back in the box. This is now after I've trimmed his beak. He was relaxed enough for me to trim it with one hand. And now listen to his noise. See the difference? He's just kind of cooing at me. He keeps lifting his wing because he wants me to pet him underneath his wing. He puts his head down and says, oh, just pet me a little bit more. This is the same bird who was in a high sympathetic state when he came in. And now he's just giving me kisses and loving on me. And he's so appreciative. Literally 3 or 4 minutes of frequency music, and we entrain this bird back into a parasympathetic state. Any species it works on. This is a different device that I have, which also is like a rife machine and a vibration plate. These snakes had come in by an owner who had just purchased them. He thought they were ADR, they weren't doing right. And so I gave them exams. I didn't see anything physically abnormal, but I decided to use some frequency to entrain them into a parasympathetic state and to just reduce inflammation in their body. What I want you to notice is when I play the video, the little black things on top of their cages is concentrating the frequency in that area, and they curl up literally underneath the frequency. So they were wanting to be as close to that frequency as they could. How did they know that? It's this innate intelligence. This is a bunch of our different animals, how we use that same vibration plate, and it's like a rife machine. So we can do all different kinds of frequencies on this, from full sympathetic to full parasympathetic, and just in training tissue back to its normal frequencies. The next thing I want to talk about is fascia decompression. Now, fascia has only been a conversation in less than the last 20 years. And now that we're starting to understand what fascia is, we start appreciating the magnificence of it and the importance. So on the side next to me is Deanna Hansen, who is the co-founder of this course with me. We call it the Cinderella tissue. I did a whole blog on this because it not only connects everything, but we've dismissed and overlooked it for so long. Things like scarring, gravity, aging, inflammation, trauma, lack of movement, all causes this fascia to start to grip and tighten down because it's trying to hold the body into place. And if that fascia isn't flowing, it's where the communication from mitochondria to all the microorganisms flows through. So when we have something kinking the hose, if you will, then things can't flow through there appropriately. So this is Kuda. I'm using his as an example of showing you how there's fascia gripping because he's such a short-haired dog, you can actually see it. So he's under 4 years of age. He came in because he had a little wart growing on his leg, a little tumor that we took off. But then the owner happened to mention that he was having a lot of problems with his left hind leg when he first gets up. So if you look at the video on the left, do you see how his tail is pulled to the right a little bit? And his left hind leg, he's not standing on it with his full weight, and it's kind of pointing out. We call that the flat tire. On the right-hand side, before I play the video, I'm going to show you that he has a bunch of wrinkles. Everywhere where you see that wrinkle is where the fascia is now gripping down and starting to have adhesions below. When that happens, you don't get good energy flow through there. Lymphatics aren't working as well, and everything that becomes the end user is going to become compromised. So here we're just showing you all of these ridges that are in his body are not muscular folds. He's a muscular dog, but what we're looking at is the surface of the skin where that fascia is starting to grip. I did x-rays, and on the ventral dorsal view of the left, you can actually see that his spine actually has a little bit of a curve to the right. That is not positional, that is real. And then on the lateral view, he has a little bit of an arch to his back. It's not a lot, it's subtle, but it's there. And again, that is not positional. So now I'm going to show you how we actually use fascia decompression. Meet little Max, 2-year-old male neutered Shih Tzu. who about 6 weeks earlier had tried to jump on the bed. He missed, and he had just a couple of moments of ataxia, wobbly, unable to get on his feet. Owners didn't think anything of it because then he turned out to be okay. Well, shortly after that incident, every time he went to walk, he would twist his hips. So this video on the left is actually from the owner. Every time he went to take a step, his body would cramp and his hips would go to the side. He didn't cry in pain. He was still eating and doing everything else normal, but he walked like he was a little L-shaped inchworm. The picture in the back is showing how his tail was pulled to the left all the time. And then this is him coming into my office. And as you see him walking around, it'll take just another second and there's the cramp. So he's doing this all the time. We took his x-rays. On the lateral view, not so dramatic, but on the ventral dorsal view between the two arrows, you can see on the left side of his body, there is a slight curve to those vertebrae. And that's because those paralumbar muscles are contracting and spasming and pulling his body out of alignment. So the left is a video. I'm going to get a little quiet, but what you're going to watch is this left hind leg. As I'm using gravity to extend his body and help to stretch the fascia, you'll see his left hind leg all of a sudden go down. Takes about 3 to 5 minutes altogether. I've already been holding him.
Just letting the gravity of his own body straighten him out.
And now you
See how he
see
just dropped his feet?
he's now stretched out. Then we did a couple of more fascia moves where I'm using again his body gravity, stretching him to the left, stretching him to the right, and holding that position for 3 to 5 minutes, just allowing the temperature, the heat, the pressure to start relaxing that fascia. 6 hours after we did the work, you'll see his tail is back in the center of his body. I did one chiropractic adjustment and the fascia work. And this is him actually walking. The shaking and the little snorting is all part of the integration of the energy after we do that energy work. And notice he is not cramping and he's not having any more of that like crab walking is what I was calling it. And still has not had any relapses, and he only had one treatment. That's a really dramatic case, but I think it states what we're talking about, that when there is abnormality in the body, if we fix the root cause of it, it's amazing how he improves. This is Moon. She came to me back in 2020 with a transitional cell carcinoma, bladder cancer. We were able to cure the cancer in 5 weeks, and that cancer has never come back. But about 2 years later, she developed idiopathic vestibular syndrome. So for veterinarians who've experienced this, we know that they are left with this head tilt. It happens in dogs and cats. And I've never come across a therapy that actually straightens their head back out again. So she came back up to me. We started doing the fascia decompression. One of the other things that happens when they get that head tilt is they get pretty weak in the rear end. You know, they're not able to see properly and orientate their body, so they get some weakness. And I do have video of how weak her back end was. Her back legs would shake. When she would squat to pee, she almost fell down. This is her after a couple of weeks of the fascia decompression. Watch how strong and springy her step is. Amazing. And in the next video, she's going to come at us and notice that there's hardly any head tilt. Remarkable. This is another energy device that I use because we are exposed to so much incoherent frequencies in the form of chaotic, incoherent light that we have to do something to help mitigate that. These are from a company called Essential Energies. They call them conditioners or towers, and they're plates of stainless steel that are layered with this special plasmonics. It's like a gel surface that when light comes into the plate, it reflects off the stainless steel through this gel phase and sends out coherent light. It's almost like you're restructuring the body through this light energy simply by reflecting it back. There's no electricity, there's nothing charging it. This is how it comes. So on the left, this is Dan, who is the owner of the company. He came down because we wanted to do some studies. So Bruno just happened to come in that day. Bruno is a very hyper dog. He never holds still. Dan is holding the plate and just literally shining it at Bruno. Within a couple of minutes, Bruno lays down. His dad is absolutely shocked that Bruno has actually laid down. That was the first thing. And then in 10 minutes, we did his live blood. So on the left is his Bruno's blood before we exposed him to the light tower. And on the right is 10 minutes after. And you can clearly say that his cells are more separated. This is 10 minutes. And they're rounder and they're much prettier looking. This is Popcorn. You'll see Popcorn again in the presentation. Alyssa is holding the tower, kind of facing the dog, just reflecting it off of him and creating more structured, coherent light reflecting into the dog. And then this is his blood on the left before treatment and his blood on the right. That is pretty dramatic. Next picture is going to be a little gross because it's going to be my knees and fingers after I had a major crash on the asphalt. So warning, warning, if you don't want to look. The reason I included this, we had just filmed a presentation for Dan and it was 10 o'clock at night. It was dark in the parking lot and I literally tripped over a parking curb. And so really horrific fall, extremely painful. But when I got home, I took the light tower and I just painted it back and forth like you see on the picture on the right. I painted it all over my knee and the pain was gone. I swear, I cannot make this up, in less than 1 minute. And it was very painful. I guess it just restructured the water in my knee. I never swelled, I never bruised, and I was fully healed in less than 1 week. But I didn't even have a limp. I had no pain. Moving on to the next technology that I like to use, this is full spectrum infrared therapy. Now, some people, if they live in the far infrared world, they think everything is all about far infrared. And then there's the guys that live in the near infrared world, and they think it's the best. I always go back to nature. What does the sun do? It does full spectrum. So I'm going to do full spectrum. So this is a company that has a variety of different technologies. I like the pads for the animals because they still produce the full spectrum infrared. They have some heat to them, which we can control the temperature. They have jade stones. They produce negative ions. It releases nitric oxide in the body, which is a whole discussion on itself. And they're comfortable on them. Where if we put them into a sauna like the one on the right, a person has to go in there with them. There's heat elements on the bottom. It's just not a comfortable situation. We also do have a full infrared sauna that our pet parents can go in with their fur babies. But we like the pad because the owners can actually purchase them and do the infrared therapy at home. Then after we get them in a parasympathetic state and we've now gotten their blood flowing and we start the detoxification process of the liver, we want to do assisted lymphatic therapy. This is a special machine that produces a microcurrent, inert gases, including ozone and negative ions. And we take these probes and we hold them over all of the different lymphatic drainage points, which is acting like Drano does on your sink. It starts to open and decongest the area. And then with our lymphatics, each area of the body drains to a specific lymphatic drainage point. We decongest the area using the probes, and then we sweep the lymphatics into the appropriate drainage area. Talk about a parasympathetic state. When you have this done to you, you are so relaxed. You want to fall asleep. And obviously, these animals feel good about it. There's no one holding them. Even cats like this, and cats don't like anything. Right, Daniel? We have to have your kitty do this.
Oh my God, I can't even imagine.
So what the benefits of doing assisted lymphatic therapy, in my opinion, the liver and the lymphatics are the two biggest organs of detoxification because they do the most work. But this particular technology also helps to produce the immune system by increasing T lymphocytes and aiding in detoxification of the entire body. So this is an example of Hope. She was lit on fire by an abusive owner. She was being fed a processed kibble diet. She had been on massive amounts of antibiotics, pain medications, non-steroidals because of her injuries. And she was doing okay until she turned 11. And then she spiked a horrific fever and was diagnosed with the autoimmune disease of rheumatoid arthritis. When she came to me, she was not eating. She couldn't walk. She refused to walk. She was in so much pain. So we did ozone, we did lymphatic therapy. And when I got done treating her, we also did a chiropractic adjustment day one. When I got done, it happened so fast that I didn't get a video of it, but she got up out of the trough, started walking around my office, found some raw food, freeze dried, and scarfed it down. So the rescue that brought her in was amazed. She continued to go on weekly treatments and she went on to do thriving. It was remarkable to watch how much better this dog got. So here she is getting her lymphatic therapy. On the left are all the different things that we did to support her. And boy, when we added hyperbaric oxygen to it, it was a whole game changer. This is Popcorn. This is a dog that we saw earlier. Popcorn is a VIP. He's a very important pet, and he is a service dog. He lets his mom know when her blood sugar drops. So he had come to me because he kept suffering from repeated bouts of vomiting, not eating, and having diarrhea. We diagnosed him with inflammatory bowel disease, did all 6 steps that we talked about before. This dog went on to start to thrive. But when we did his lymphatic therapy, what I want to show you is that 4th phase of water. So on the left was his blood before we did lymphatic therapy. His blood is barely moving. That is a video. He has a lot of rouleau. The 4th phase of water is quite collapsed. Immediately following lymphatic therapy, we've expanded that 4th phase of water. Now we have cells that have not only nice round bodies to them, but they're now separated. And look at the energy that they have, how they're flowing from each other. And that always correlates with how physically they feel. So it's amazing. Then we move into our foot detox bath, which ironically also helps to support a parasympathetic state in humans as well as pets. So here he is, his feet are in the detox bath. Pretty gutsy of me to take a white dog and put him into a bath that's going to turn his feet orange. However, it does wash off, guys, so not to worry. And we do this with all of our patients. So if they're big, we just put either their front feet or their rear feet. The dog on the far left of your picture had an osteosarcoma. So you can see on her right front leg how swollen her foot is. So we just propped her up on a big bed and just put her feet in. And the little guys, they love it. Again, they're getting very parasympathetic. So they just enjoy sitting in that bath. It uses electrolysis to pull out chemicals, particularly heavy metals. Even our staff enjoys it when they're taking a break. This is my daughter, Alyssa, doing her foot detox while she's getting her computer work done. Ozone is another modality, even though it's not technically a machine technology, it does get produced through a machine. And we use ozone. I can't imagine practicing without it. If you are a practitioner out there, or even a pet parent, because we teach pet parents how to be able to do this at home, if you aren't using ozone, you are missing one of the greatest therapies of all time. We can do it intravenously, we can do it rectally, we can bubble it through oils and breathe it that way safely, we can do it subcutaneously, we can use it as a lavage, a rinse, we can use it intraoperatively, we can use it after dentals, and even as aquapuncture for our acupuncture cases. It is remarkable. But the reason I put this in is because when we give it rectally, you would think, what is it really doing? It's going up the rear end, and how is that affecting the body systemically? Well, this is how we can prove it. So on the left is a dog before rectal ozone. You can see the cells are all gnarly and stuck together, and they're not even moving. 10 minutes after doing the rectal ozone, and the disclaimer is the only reason it took 10 minutes was by the time we got the dog, drew the blood, got to the back, it was 10 minutes. And there's his blood afterwards. And again, you can see it moving. The cells are now round and separated. There's no more rouleau. And that's because of how it affects the 4th phase of water. So let's put it all together on Abby. Abby came to me looking this sick. She was only 2 years of age. She wasn't thriving. She was lethargic, not eating, chronic vomiting, chronic diarrhea. We did a thorough workup, and Abby turned out to have a hepatic shunt. So I sent her to the University of Florida to see if she was a surgical candidate. Unfortunately, she had literally no portal vein. So the University of Florida said, I'm sorry, we can't do anything for you. She's never going to do well. You should consider euthanasia. And that was because, not that they meant to be mean about it, but they truly had no therapy to offer. Well, the owner had been a long-term client of mine. And so she came back and she said, what can we do? We started doing PEMF, laser, ozone, really once or twice a month. That was it. Got her on a species appropriate diet, the right supplements, doing lymphatic therapy on a weekly basis. This is her for 3 solid years. Is that a ball of cuteness? That's the money shot right there. This little girl was the happiest little dog for 3 more years. Now, did she live forever? No. She ended up having a severe bout of immune-mediated thrombocytopenia. She died before I could even treat her. But the point is, she had 3 more years post-diagnosis of fabulous quality of life, and her moms absolutely cherished that extra time they had with her. Hyperbaric oxygen is the next therapy that I want to talk about. And we've already mentioned a few times that oxygen is the crux of how we stay healthy. Bad things do not grow in an oxygen-rich environment. In the olden days, we only had the hard chambers, which were potentially dangerous. There were several incidents of accidents happening in chamber, very expensive to own, very expensive to run, not really available for the average owner. But we now have soft-sided chambers, and they do everything that we needed to do. They go to 1.3 atmospheres, and they push enough oxygen from our lungs out into the tissues to get the effect that we're looking for. So for wound therapy, cancer cases, anything that you need to have increase in oxygenation. The one thing about hyperbaric oxygen therapy is that it requires a number of dives. So we have a minimum of 4, an ideal of a minimum of 10, and in most cases, many, many dives are required in order for the body to continue detoxing and doing its healing process. So it's wonderful that these machines are now affordable to the average pet parent. Not saying they're not $100, guys, but they are definitely affordable when you consider that you can actually set these up at home and they're very safe to do. So this is Smudge. He was diagnosed, he came in on a Christmas day in 2020 in Connecticut, was where he's from, and he was screaming in severe pain. You can see the back of his head is shaved. They went to an emergency clinic. They had a spinal tap done. They did do blood work on him. His white count was 91,000. Normal is under, say, 17. Probably his normal would have been 6,000 or 7,000. He's 91,000. And they did test for Lyme's disease, but the testing modality that they used did not show it. So they assumed it wasn't. And they put him on antibiotics and steroids. And yes, he did get better. However, a month and a half later, as the owners tried to decrease the steroids, he had a severe relapse and was again screaming in pain and couldn't lift his head. Now they're in Florida, so I get to see him. This was a list of all the different therapies that we did and the diagnostic that we did. It turns out that after 2 weeks of treating him, no antibiotics, by the way, only ozone, hyperbaric oxygen, the therapies that we showed you, his white count had gone down to 30,000, still high, but he's doing much better. Rest of his blood work wasn't too remarkable. Platelets elevated, indicative of the amount of inflammation. Liver enzymes a little bit elevated, alk phos elevated. But the biggie was super high in heavy metals and had a few deficiencies, particular deficiency in vitamin D. Here we go again. We're seeing this consistent pattern of vitamin D deficiency. Fortunately for him, his magnesium was normal. So we did supplementation. When we tested at the onset of him coming in, we tested his inflammation with the CRP, off the charts. So kind of coincided with the amount of pain that he was in. The TK1 is elevated by 3 things. 1 is cancer. 2 is Lyme's disease from cellular reproduction of the spirochete in the cell, killing the cell. And then osteoarthritis is the 3rd thing that'll make that go up. So remember that number, 13.2. We treat him. This is him after his very first treatment with us. He's able to walk. He still doesn't want to lift his head, but the owner, I know it's a real blurry picture because the owner took it, but just the fact that he went outside and could actually walk and was interested in smelling things and wagging his tail, they were thrilled. That was day 1. We tested him again after 4 weeks of therapy, and all the inflammation is resolved. Okay, so right there, that is just ridiculously awesome. But the TK1 has now doubled. And the reason for it doubling is we still had spirochetes that were still replicating and killing cells. So it wasn't that we were done, but he was much, much better. On the left is before we got started with treatment. On the right is a happy smudge running around the house, acting like a little maniac. This is Roxy. She came in on emergency because she'd been licking her foot and the owners noticed it was swollen and she wouldn't put any weight on it. Well, they didn't really give me a strong history about how it got swollen. So we were thinking maybe she got bit by something or a sting. You know, obvious had cellulitis in there and she had some oozing of serum. But I had a suspicion that there was something inhibiting circulation in this foot. So I immediately started using frequency therapy, lymphatic drainage intensely on the foot. And it's a good thing that I did. It's going to get a little gross again, guys. So date 10/23, 2 days later, her foot starts to slough off. Now, this is in spite of the fact that I am intensely doing laser and lymphatic drainage and really working to keep circulation going in this foot. 5 days later, you can see this is really getting ugly, but I started working on scar therapy. So I'm doing what is called minor autohemotherapy. I'm injecting some of her blood mixed with ozone all along this scar. And then on the 30th, we see the kind of the peak of the sloughing of the tissue. The foot is uber swollen, but she's walking on it, which was quite remarkable. We're treating her every day with hyperbaric oxygen, ozone rectally, ozone soaks on her foot. We're doing everything we can to improve circulation. And then by the 2nd of November, we start to see that we are no longer losing tissue and we're starting to get some granulation tissue. By 5 days later, we're starting to get a beautiful granulation bed. Foot still looks swollen, but within 2 weeks, we're back to normal size foot. The granulation tissue is contracting down and we have a fully healed foot. Pretty remarkable. Most veterinarians would have considered amputation and probably would have ended up having to amputate because there's not a lot of modalities in the traditional world that will help with that much circulation and lymphatic movement. So on the left is all the different things that we did. It was intensive, but she now, as a 2-year-old, still has her foot. Halo therapy is also called dry salt therapy. And this is a salt booth that we have in our office. Salt has a lot of medical benefits. In the respiratory tract, it's sort of like taking a toothbrush and cleaning the respiratory tract because it takes all of that cilia and it starts to pull and remove all that thick mucus and inspissated material that is lining the respiratory tract for a lot of our patients that have chronic upper respiratory tract disease. Of course, if they take a nice deep breath, it's going to get down into the bronchial tree, so it's great for our cancer patients. It's also wonderful for skin disease. We have a lot of animals that come in with skin issues and seborrhea and itchy skin and a lot of sores, and all that salt when it lands has that nice antimicrobial effect on the body as well. So this is Beavis. He was the one that was in the salt room in the previous picture. He came in as a kitten with upper respiratory tract infection. And every veterinarian has seen these feral cats coming in with this illness. And we know that if untreated, even treated, oftentimes these turn into chronic shedders. So I was really on top of this cat. And he was in the salt room every day. We were using ozone, flushing his eyes, giving it rectally, changed him to a raw diet, had him on milk kefir for his probiotics. In 24 hours, he's looking a little bit better, but he still has a runny nose and weepy eyes. Wait for it, guys. Here we go. 3 days. No antibiotics, no lysine, no steroids. He was a normal cat in 3 days. Went home, never infected anybody else, and never had a relapse. Woo! I should be hearing hooting and cheering by now, and I know you're doing it, just your speakers are off. This is Bobby. He came in, he came in with a chronic history. He was an FIV cat positive, and he was from France, and he had this really horrific sinus infection. He was always dripping snot out of his nose. owner had taken him to multiple veterinarians. They had used massive amounts of antibiotics and nothing was making it better. And we know cats won't eat when they can't smell. So we were really vested on helping to clear up his sinus infection. So we put him in the salt room every day. We did his pulse electromagnetic frequencies, lymphatic therapy, something called crystal fusion light therapy using gemstones and light passing through the gemstones. Of course, he was in the sauna with his mom. And here he is in the sauna. Truth be told, he was a burly little guy and he would bite anybody that came near him, including his mommy. And right after we took this picture, he bit the snot out of her hand. Thank God she loves a cat. And we continued with our therapy. We radiographed him and saw that he had this little nodule that ended up going away. I wasn't sure if it was a lung tumor or what, but it did resolve itself. And we were left with the kitty that had a clear nose and all of the snot resolved, and he went back to eating and thriving. This is Wiser. She came in because she was limping on her front leg, and we went to take radiographs of her elbow and shoulders, and I saw a snow globe in her chest. That is all those round balls of different sizes is all cancer. She had no symptoms of cough, no symptoms of shortness of breath. So when we took the x-ray, of course, the owner was absolutely shocked to see that she had that much cancer in her lungs. But this owner, as opposed to the owner who had the 3 tumors in the abdomen, this owner was very vested in helping this dog to get better. So we started our 6-step theories. We put her in the salt room, and this dog lived an entire year. Let me go back and show you that x-ray. There's almost no normal lung tissue in there. How did this dog live an entire year with no symptoms? She went on car rides with her mom. Fortunately, the owner had been caregiving for her mom, who had just recently passed away. And so she wasn't working, and she had an entire year to spend quality of time with this dog who had quality of life. And that was priceless for both of them. Now I want to get into one of my favorite things, which is light therapy. Most people have not heard of, most people have heard of photobiomodulation because there's a lot of laser companies out there now that are talking about photobiomodulation or low-level light therapy. But this is where we're using the visible light spectrum on the surface of the body. And that's awesome because the lower frequencies, the ultraviolet, blue, yellow, green, those colors can't penetrate in through the skin that's intact because they're absorbed by melanocytes. So you can only penetrate the skin through red and infrared light. Well, we do an activity that helps it to go intravenous. So in photoactivation, it's changing the enzyme activity of our cellular pathways, and it makes them more effective in ways that it wouldn't have done without the light. So it's super important that it improves all of these metabolic triggers that function in the body, including the immune system, repair processes, improves redox potentials. All of this stuff is happening with no side effects. We also do what is called photodynamic therapy, and that's where we add a photoactivator for the purpose of treating abnormal cells. This picture that I'm showing you is laser that is used intra-articular. So we put special needles in. This dog had a cruciate rupture, and the owner did not want to do traditional surgery. So we put these photoactivators into the joint, and then we run a fiber optic through that catheter. I'm actually going to show you an entire case here in just a moment. And this is done under general anesthesia. The advantage of doing low-level light therapy and particularly photodynamic therapy is that we can affect the spectrum of pathogens, where antibiotics only affect bacteria, and we're only going to have them for a few more years. Using photodynamic therapy, we're affecting bacteria, parasites, viruses, and fungi. It's safe and effective. This is the topical application that we just talked about, but we can't use it for anything other than red and infrared light, but it's still wonderful to use. If you have an open wound, then it's game on. But one of the advantages of this, it does stimulate the vagus nerve and helps to put them in a parasympathetic state if they're not stuck in cell danger response mode. And it helps to release nitric oxide, which has a plethora of metabolic activity. I have to try everything before I buy and give it to my patients. And so I am in Mexico getting training on this machine, and my daughter and I are getting intravenous light therapy ourselves. And it was like incredibly awesome. So meet Tucker. He is the first dog in the entire United States to receive photodynamic therapy. He presented to his veterinarian limping on his left front leg. She x-rayed and correctly diagnosed that he had osteosarcoma at the age of 4. So he was referred to me for therapy. The owners wanted to do everything possible. Here you can see on the left picture the swelling that was over the carpus. And now you can see a few weeks later the periosteal reaction and the lysis that is happening in the bone. Was interesting that within 2 weeks of starting our photodynamic therapy and all the other modalities, he starts actually walking on the leg. He's playing, he's having a wonderful life, his appetite's improved, he's just acting phenomenal. This is him getting the rainbow of colors intravenously, and we would use different photo activators. These are natural compounds that we give intravenously, and then we follow it with the color of light that would activate it. So vitamin C is activated by 3 different colors. Curcumin is activated by blue. And so we have all these different modalities that allow us to increase the photoactivity and the response of improving enzymes and metabolic functions. We did a total of 10 weeks. We saw the swelling's gone down. He's acting great. We're taking radiographs. And at the 10-week mark, we sent his radiographs into a board-certified radiologist who confirmed that his cancer was resolving. Osteosarcoma. This is Bo on the left, and Bo had originally come to me with an anal sac carcinoma. We know they have a tendency to metastasize and reoccur. It was surgically removed by a board-certified surgeon, and then he came to me for our 10-week program of everything I've already shown you, all the different modalities, diet change, and all the supplements, which we didn't talk about, but he goes on the full program. Anal sac never returns, never gets anal sac carcinoma again. But a year later, he develops an oral mass in his mouth, something very common that we see. We can cure one cancer, but if the terrain isn't fully back to normal, they can get another cancer. So he develops an oral melanoma. And to my knowledge, in my literature research, I've never found anything that is effective against oral melanoma. We started him back on our program, and almost a year down the road, he never grew the tumor. It depigmented the roof of his mouth, but the tumor never grew in his mouth. Had phenomenal quality of life. And then one day he had a seizure that didn't stop. They lived in Texas, so they went to an emergency clinic and he was euthanized, but his tumor never grew. This is Jim. He was in a dog fight with his own fellow housemates. That's his jugular vein. So in this next video, we're prepping him for surgery, and I lift this flap on his neck, and there's his jugular vein. I don't know how those dogs missed that jugular vein, but it was pretty extraordinary. So we used laser and ozone. I did put this dog on an antibiotic, but just for 7 days. We used silver, of course, a variety of different natural anti-inflammatories. This dog never lost 1 stitch to dehiscence. He was eating 24 hours later, took the drains out at the end of 10 days, and he was fully healed. So he got on the shoulder and all the way from one ear to the other ear. It was just filleted open. However, a year later, they bring in a different dog, just showing him healing. A year later, he comes in and he has this big tumor in his mouth. And the owner said that he had developed this oral mass. They'd gone to a board-certified referral center who said that he had an oral melanoma and that there was nothing they could do other than remove the jaw, and he would still die of his melanoma because they didn't have any other treatments. And they asked if there was anything I could do. I never, remember, say there's nothing more we can do. And I said, well, we're going to give it our best try and see what happens. So this tumor was so big in his mouth that he couldn't close his mouth. So it was making eating difficult. After 4 weeks, the tumor had literally melted out of his jaw. That's a picture of him a month into therapy. Now, we didn't sit on our laurels too long because 2 weeks later, we saw a little breakout on the top of the nose and the tumor started growing from that area. And it did get rather engulfed. However, with ongoing therapy, he had 100% quality of life. And until the day he decided that he needed to transition, he had 100% quality of life. On the right is little Bobby. He had a liver shunt when he came to me as a 4-month-old. We did his blood work and his liver enzymes for over 700. We worked him up. He had microvascular dysplasia. And this owner is so dedicated. This dog came to me every month for his pulse electromagnetic frequency, intravenous ozone, sometimes lymphatic therapy. And we've been able to manage his ALT, his liver enzymes, under 250 for almost his entire life, just keeping up with that regime. So he's doing great as a microvascular shunt. Emma on the left was, she had a mast cell tumor on the inside of her knee. So we removed it per the owner request. And then we used a product called neoplazine, which loves to eat mast cell tumors in particular. And everywhere that you see green, it was eating tumor that I couldn't see. Remember, I removed the bulk of the tumor and it seemed like it all came out in one ball. But with mast cell tumors, they have tendrils that go out quite far. And on Mother's Day, they called me and asked if they were supposed to see the bone hanging out in the leg. And they said, no, not really. So they came in, and that was an example to me of how far that mast cell had actually infiltrated into that leg. So it ate up all the cancer tissue. All I had to do was then go in and start fostering granulation tissue, promoting it to grow. And over a period of just a couple of weeks, we were able to get full closure, beautiful granulation bed. There it is closing. It did get fully healed. There she is fully healed. And she lived to be almost 20. She just passed away just shy of her 20th birthday and never had a relapse of her mast cell tumor. This is Chikari, had a squamous cell carcinoma diagnosed at a referral center. It started in her right nostril. Owners did not want to go through the traditional mode, so they came to me. And one of the things I want you to appreciate is when we start doing the therapies, here she is getting her photodynamic therapy. She was in the salt room. She was in the sauna. She was in the foot bath. She had lymphatic therapy, all of her IVs like all the other dogs. These tumors get woke up. The body starts to recognize them and go, oh, there's something that doesn't belong there. And they get rather angry. So into May and June, we started seeing discharge in the left nostril, but we towed the line, we kept going. And in 16 weeks, the entire nose was back to normal and there was no cancer left in her nose and it never returned. This is Bentley. He had developed a few blisters on his nose, went to the vet put him on a steroid cream. The lesions came back and got worse. So they did a biopsy and it came back also squamous cell carcinoma. They went to a board certified surgeon, oncologist, and they said the only option you have is to remove the nose and he's still going to die of the squamous cell. So they didn't want to go that route. They came to me. We started working on him 2 days a week for months that we worked on this dog. At the worst of it was the left. This tumor got really angry and we would get just as aggressive back. And then there was a sudden period of time in December when we started noticing that there was no new lesions coming out and his lips started to reform, the granulation tissue filled in, and he even repigmented. This is Ratchet, 8-year-old male neutered bully that went to the vet because he broke a tooth. It kept bleeding, so they went to a referral center. He was correctly diagnosed with splenic lymphoma. The ultrasound showed a very big spleen, very motley looking, and he was that sick in the beginning picture when he came in. This is his live blood on presentation. That, my friends, is sludge. That isn't real blood. And I put him in the PEMF device. Even the first hour of treatment, we started to get some of the cells to break apart. We continued therapies for an entire 3 weeks. And then at the point where we got his blood to do this and actually separate is when we saw him clinically start to really make changes. He was eating better. His energy levels were up. He was feeling great. Of course, it's in the spleen, so you can't monitor it from the outside. At the 10-week mark, the owners wanted to know how he was doing. We did an ultrasound. And the radiologist came back and said there was no evidence of cancer in the spleen. So at first the radiologist said, oh, he must have been misdiagnosed. Well, I got the original ultrasound, sent it to him, and he goes, no, conclusively that was splenic lymphoma. Whatever you did must have worked. And this dog lived many, many more years after that. So here he was, 10 weeks of therapy, only twice a week, cancer-free. What a difference in this dog's demeanor. This is Little. She had this tumor removed 2 times before me by a board certified surgeon, and it kept coming back with a vengeance because the underlying root cause was never addressed. So when the cat came to me, they said, can you make him visual again? And I had no idea what was underneath this tumor, but what do veterinarians do? They jump in and get her done. So we did the surgery. Look at the amount of stretching that that eyelid had to do to accommodate this tumor. I knew I didn't get it at all, so I did some other therapies in there. And this is 5 months later, this tumor did not grow back. And he was visual and had great quality of life. This was Chloe. We're going to move into some other types of things now. She had a very deep corneal ulcer, but at 15 years of age, her owners did not want to put her under anesthesia. So they said, what else can you do? So I did ozone, light therapy, and serum. And in 4 days of 4 days consecutive therapy, she was fully healed. Unbelievable. This is Sammy at 15 years of age, became suddenly paralyzed, went to their vet. The vet sent them to a referral center. The referral center said that they suspected that Sammy had lymphoma in her spine and that was a poor prognosis. They should consider euthanasia. And they didn't want to do that. So they came to me. This is 4 days into therapy. Now, I really didn't know how she was going to respond because what if she really did have lymphoma? Well, in 4 days, she could crab walk. And if she had not gotten any better than that, the owners were thrilled because she could use her litter box. We continued therapy. This is her in 4 weeks. The owner reports that she's doing behaviors that she hadn't done since she was 6 years old. Sammy went on, this is her getting acupuncture. Sammy had a little bit of a personality issue, and 99% of the times that we treated Sammy, we had to do it under general anesthesia because she would really attack us. But this particular day, she started feeling better. And I think a lot of that had to do with she had gut dysbiosis. She had a lot of pain and inflammation in her body, and maybe that's what made her burly. But as we started to heal the gut, change the microflora, she actually became a nicer kitty. And she went on to live, by the way, to be just into her 20th birthday. So 5 more years of high quality of life with no relapses. This is Kim. This is the typical degenerative disc disease. I want you to hear the owner whining. I mean, she just sees her dog paralyzed. She takes this video. She goes to a referral center. They give her a price for surgery that she can't afford. So they take the dog home and they eventually found me. So now the dog's been paralyzed for 5 weeks. And we just started intensive therapy. This dog in 4 days was able to stand and able to place her left hind leg was the first thing she could do. First, she could actually support herself. And then she was able to move her left hind leg. I'm going to try to leave it there long enough for you to see. She actually moves her foot. Her right hind leg is what she placed. And then she was walking well before 2 weeks, but the owner didn't send me the video. One happy dog, one happy owner. Dog did get a haircut. So same dog though. Amazing. Ireland, we see so many of these degenerative disc disease dogs. She came in as a 3-year-old paralyzed, and the owner was a nurse. He thought that there was nothing that we could do. So he actually brought her in to be euthanized. And that doesn't usually happen on This is her 3 weeks later. No steroids, no surgery, no non-steroidal anti-inflammatory. How cute is that? We see a lot of dogs that have ruptured cruciate ligaments. When I met Bama Bear, I was actually going on a house call to euthanize this dog. And when I asked about the conditions and why they were euthanizing a 5-year-old dog, I found out that he had bilateral cruciate ruptures. And they were told by their veterinarian there was nothing that could be done. So they were just sad about putting him to sleep. When I gave them an alternative, they were thrilled and they said, we're willing to try. So here we are, muzzled because he was very aggressive. He was in so much pain. We get him to the office. Here he is. This is going to be where you actually see how I do the injections into the stifle joint. So first I place my endo needle into the joint. And then I'm going to, the reason you're not getting any joint fluid is this was already ruptured. Now I'm doing PRP therapy, which is platelet-rich plasma. And I'm going to put that in. I'm going to actually put 2 needles in. This is just the left side, then I'll do the right side because I want to be able to use more light therapy quicker. Now I'm injecting a prolotherapy, which is a
May
mixture of
23rd.
nutrients that are going to go into the joint. And now I'm going to follow that with ozone. Now the joint capsule is already ruptured, so I'm just going not only into the joint, but it's probably infusing around it. And now I'm going to put my fiber optic cable in. And of course, it was because I was videoing. I had a hard time getting it in. Normally it goes
It's crazy. I
once I
remember Hershey, but I can't place it for some reason. I remember. Where is Hershey?
and my audio is off, so that must be coming from the audience. Okay, so now I screw it in. I do both sides. And this is him under anesthesia. We did both legs at the same time. We have all the colors of the rainbow that go in, and then we wake him up. And this is him literally walking post-op. He got up on his own and he's walking around my office going, "Where's my next meal? I'm hungry." This is him about 10 days later. He came back in for a recheck. Mind you, no steroids, no surgery, no non-steroidal anti-inflammatories, a lot of rehabilitation, and he is doing fantastic and is still to this day still doing fabulous. This is a dog that developed a really severe dermatitis. It's around the vulva, and she went to the University of Florida. They did 3 different antibiotics, so they cultured all kinds of nasties out of this, put her on steroids orally, topically, and it wasn't getting any better. So they decided to come to me for therapy, and we took her off all of the drugs because it was just destroying her gut and her microbiome and her immune system. So during one of the hyperbaric dives on the first day, I just happened to notice one little drop of urine coming out of her vulva. It just so happened she was facing away from me in the hyperbaric chamber. I was in the chamber with her. And I realized that this dog was having just a tiny bit of urine scalding that was causing all of this inflammation. So I took care of the urine dripping, and this was her healing in under 2 weeks. Again, no antibiotics, just using laser and ozone. Poor thing, she was so painful because this was right around her vulva area, inner thighs, and all the way up her ventral abdomen. And she just did fantastic. Another gross one coming. This is Max. He was left out in the Florida sun without any shade. And at the time he came in, all I got from the history was that he had an infection in his back. And I did a full workup. As soon as I touched water to this dog's back, the skin was just sloughing off. It smelled horrific. He had a Pseudomonas infection. So I did cultures, I did biopsies, sent it all in. Meanwhile, I started doing our therapies. The techs had to use a mask when they were doing therapy on this dog because it stunk so bad. But because of the ozone having more of a euphoric and analgesic effect, and the salt and the lasers and all the things that we were doing, this dog was incredibly comfortable. Here you can see the back is going to slough off. I was really hoping we could save the skin, but we were just a tad too late. And it literally just all that tissue died. Now, mind you, that is over 50% of this dog's back. So in many cases, this dog could have gone septic on us, but fortunately did not. The next picture is a little gross. It's a video, and this is the skin as the body naturally removed it. What is today's date? August 27th. This was the whole back area that is just peeling up and off. So all I had to do was trim off the back. And I rinsed it with ozone. And when I rinsed it with ozone, it kind of bubbles up a little bit. At that point, we knew we didn't have to keep doing the therapies that we were doing. So we started focusing on getting tissue contraction and collagen wraps and all of that. And very quickly, this wound was able to heal in. And the final product was United States on his back with the little tip of Florida right there on the bottom. We were so thrilled. This was Luna. Owner brought her in right after Christmas, had no idea what happened. All of a sudden, she hears the dog yelp. She turns around, there's a little poop ball on the floor, and Luna is profusely drooling. So I open her mouth and I see this horrific burn. The bottom of the picture is where my finger is, and that's her lower canines. The burn was over 50% back on her tongue, and it went all the way across. If we didn't stop that burn and stop the damage, this dog would have lost her tongue, and that would have probably been the end of her story, because she didn't have enough tongue to eat or drink. The burn went all the way across to the other commissure. We started immediately doing massive amounts of topical therapy, ozone, lymphatic therapy. I had the owner doing therapies at home. She came in every day for her laser therapies. And within 24 hours, this dog was eating. I couldn't believe it. And 1 week, this was fully healed and she never lost her tongue. This is Dazzle, came in to be euthanized because the owner had gone out that morning, smelled something bad, and saw all these maggots around her vent. Ironically, for whatever reason, she laid an egg. So I said, well, we don't have to euthanize. I think we could treat her. So I started doing ozone flushes.
All right, so we can see there's a lot of maggots all in the perianal area. She laid an egg this morning.
So here, I'm just going
And
to
we're
flush it with
flushing ozone.
ozone. And then I'm going to do red light therapy. And I did blue light
We're
therapy,
doing the
no
blue
antibiotics.
light with the laser
The blue was cool because the maggots
as
look
our
gorgeous.
antibacterial.
We did 2 treatments in a row, and on day 3, all the maggots were gone because we know they're only eating necrotic tissue, and little Dazzle was fully recovered and went on to live a few more months before the end of her life was naturally at its end. This is Rocco. He was a rescue. He had chronic skin disease his entire life that the owners battled with, tons of antibiotics, tons of different drugs to stop the itching. And he just kept getting worse and worse. He was at a referral center. They kept loading on more drugs. And then he developed a head tilt. And that's when the owner said, okay, we got to go do something different. So they brought him in. And what I decided to treat was the inflammation. Yes, he had an ear infection. Yes, he had a lot of other stuff going on, but I focused on what was the root cause, and that was his inflammation. So I went through our entire detox protocol, the IV therapies, etc. He had 2 full treatments and 1 just detox day over a period of 10 days. Here you can see he has a severe head tilt, wide stance when he walked. This is after his first treatment. His head is 50% more straight than it had been. And at the end of 10 days, he was totally back to normal, no head tilt, ear infection cleared up, even though I didn't treat the ear infection, I treated the inflammation. And what the owner was even more happy about was, for the first time in this dog's life, his skin disease cleared up. And again, all I treated was the inflammation. This is Ellie. This was a collapsing trachea, which we all see a lot of these dogs. Collapsing trachea, of course, is inflammation that hits the trachea and causes it to be very floppy and weak. So she had no quality of life, coughing all the time. She had shortness of breath, exercise intolerance. She was a hotbed mess. We did a full workup on her. The owners did not want to give up on her. She came in every day for therapy, which included her frequency therapy and the salt therapy, et cetera, et cetera. And this was her at the end of 4 weeks. She also lost weight, got feeling better. And I just got to play the audio.
Tell me how she's doing, Mom.
She's doing great. Her energy's back. She's playing again. And she is finally her normal personality.
Awesome.
That's what we're striving for, is giving these dogs back their quality of life. This is Isis. She's 8.5 years old, an English bulldog, suffered with chronic pneumonia, chronic seborrhea her whole life, just sadly had a really challenging immune system. And here she is with Ellie doing treatments together. But Isis ended up developing this really severe skin infection, which covered her whole entire body. She was a scab from tip to toe, and her lymph nodes were enlarged. I did do a lymph node biopsy, and I put her on antibiotics for just 7 days because of that. And it turned out she just had reactive lymph nodes and allergic skin disease. So we really started doing heavy dosing treatments with ozone, and including ozone baths. This is a technology that we have the ability to ozonate the water. And then we would just soak her in that ozonated bath along with either doing IV and or rectal ozone, and then minor autohemotherapy, which is where we take a little bit of her blood, mix it with ozone. Sometimes I put a homeopathic in it, and then we re-inject her with that at different acupuncture points. And this was her in just a matter of a few weeks. It is not a quick fix. I'm not saying that this is going to happen overnight. It's not like a steroid where you see immediate results, but we also have long-term benefit and no negative side effects. This is Noah. I put this dog in here because we know that raisins cause kidney failure. And if you look at the literature, 1 or 2 raisins can cause that, agreed? Well, this dog got into dad's little baggie of it was pumpkin seeds and raisins that he took when he went camping. And sadly, this dog ate the whole bag. So I had the owners induce vomiting before they even brought him in. And you can see there's a massive amount of pumpkin seeds and raisins in the vomit. Well, what we weren't sure of is how many actually went down the GI tract. So we intensely started treating this dog with hyperbaric oxygen and ozone and lasering the kidneys and frequency therapy and, yada, yada, yada. This was the dog's bowel movement the next day. So obviously with that many pumpkin seeds in the poop, a lot of raisins must have gone through that GI tract. For whatever reason, this dog had 0 impact on the kidneys. And I'd like to say it was from all of the therapies that we were doing that were able to protect the kidneys from the damage, especially the amount of oxygen that we were pushing into this dog. Snake bites, we all see a lot of those. On the left-hand picture, you can see the massive swelling on the the right side of this dog's face. And for most of us that treat snake bites, we know that the swelling can last for a very long time. We use a vial of antivenom along with ozone and lymphatic therapy and hyperbaric oxygen. And in 36 hours, the swelling was gone and this dog was back to normal. Did I know it was a snake bite? Yes, because when we did her live blood, it's all echonocytes, and this is a hallmark for snake bite. 18 hours later, I repeated the blood and all the echonocytes are gone. Pretty remarkable. And this is our last case, but this is an important case. This is Prowler. Prowler was the only child of this couple who happened to be retired police officers, and they owned a gym. And she was diagnosed by a different veterinarian with advanced liver disease. Her liver was huge, and there was not a single looking normal spot in that liver on the ultrasound. She came in not feeling good. She had no energy. She didn't want to eat. She just looked horrible. But the owners were not willing to give up. They didn't have a lot of money, but they gave it all they had. So they put her on all of our correct supplements to support her. And she came in once a month for an entire day of detox. We did this for almost a year. Here she is in their gym, like obviously part of the family. And she had her own Instagram page. She was another VIP dog, very important pet. And on her 12th birthday, we celebrated her birthday. On the owner's shirt, you can see she has Prowler's name on it. And in the video, if I were to show it, she has a picture of Prowler on her shirt. So to say this dog was important to her is an understatement. And we had an entire birthday party for her. We had re-ultrasounded her. And on her 12th birthday, she was cancer-free. So I want to leave you with a couple of thoughts. A lot of times we're a little afraid to try things that are different and out of the box. But the difference between a master and a beginner is that the master has failed more times than the beginner has ever tried. We're facing levels of chronicity and complexity that we've never faced in the history of mankind. We have to be able to think out of the box. So if you can, you must, and if you must, you can. And here's the last one. Some people will only love you if you fit into their box. We all know what that feels like. Thank God I don't have a box. And so I am not afraid to disappoint, and I'm going to encourage you to do the same. So I want to thank you very much for your time and your attention. And if you have any questions, I'm happy to answer them. If you want to message me, these are all my different ways of connecting with me. And I would be honored to support pet parents in their journey and veterinarians in their quest to do better by knowing better.
Oh, thank you so much, Dr. Siegel. What I'm going to do right now, there's a few links there, but I'm going to put some in the chat right now so we can click on some of these so you can connect with Dr. Siegel after this. So you can connect with us at Celeritas Digital hosting this. And then I have my LinkedIn at the bottom if you have any questions about this presentation or presentations like this going forward in the future. If you have any ideas for topics going forward to have presented on these monthly peer discussions. We have a second one coming up, and we'll be announcing that soon. That's going to be with Mark Massaro, which I'm excited about. He helped start this whole thing. And so that's going to be happening before the end of the month, and we'll be announcing that on the Celeritas LinkedIn page. But Dr. Siegel, I understand a lot of questions came up in the chat during your presentation. I'm wondering if anyone who had questions in the chat here, if you wanted to reiterate them now that the presentation is complete so we can ask whatever's on our mind about what we just saw.
All right, I'm going to open the chat and let's see what some of the questions are. I'll start at the top. Okay, we got the laptop. They did something energetically for their rescue dog. Which molecular hydrogen machine? If you message me, I'll send you the link. I don't want to make it real salesy up here, but there is one particular company that I'm more passionate about than any, and I've used a lot of them. So I'm happy to give you a direct link. I don't think a dog or cat would drink it. Oh, absolutely. They love the water. And you don't have to drink it immediately. It will stay, the hydrogen will stay in there for a few hours, but you do want to freshen the bowl up periodically. And then which commercial diets, do we know which commercial diets cause these nutrient deficiencies? Almost any kibble diet. In fact, there was a university study on kibble diets in general, and they found that 85% of animals eating a kibble diet were vitamin D deficient. And the reason is because herbivores get vitamin D, they synthesize it from the sun. So when they're out in the sun and they're synthesizing vitamin D, it goes into their muscle. Carnivores do not synthesize vitamin D from the sun. They only get vitamin D from their meat source. So if they're eating a meat source that is not grass-fed, grass-finished, then that meat source will not have a sufficient amount of vitamin D in the meat, and therefore whoever's eating that meat will not have a sufficient amount of vitamin D in the tissue. 85% from a university study. It's pretty high. And no one's testing. So we're missing such a big link to the immune system. We are omnivores as humans, and so we synthesize both from the sun, and we also get vitamin D from our diet, from our protein. All right, got that. Sleep deprived part, Daniel, that was you. You related to that. Karen, this is all incredible. I'm currently training with Carolyn Ingram in zoo from me something or other, and it never fails to amaze me how animals know innately that they need to heal. That must have been about the snakes on the vibration plate and frequency. Yes, there is so much more that we can do for our pets that is not harmful or pharmaceutical. This was all about expanding our toolkit. And then I think that was all the questions. If someone is on the West Coast, assume they can consult with you. Yes. And I do have courses for veterinarians as well. And we have access to everything that I do. So there's an online program for veterinarians, which covers everything that I do. And I also do an internship program where somebody can actually come to my practice and get hands-on training as well. All right.